as you say, more work is going to have to be done in fragile states where, by definition, maybe we don't necessarily want to put boots on the ground, or not so many boots on the ground. So how does that affect the role of the international donor and implementer?
So it's interesting, it's not just fragile states versus non-fragile states, because there's more variation within any particular country than there is between countries for these risks of mortality. So if you choose any country in Africa, the difference in mortality between the poor rural population, the urban population, is actually greater than the risk between the poorest African state on average and the wealthiest African state on average. So every country faces this issue of the poorest of the poor. And most of the mortality actually rests in the marginalized populations of countries across Africa than in the hot spots and in the fragile states. So to achieve reductions in global mortality numbers, we need to go into the large countries in the marginalized areas, northern Nigeria, northern India, northern Pakistan, southern Sudan, Somalia, those parts of those countries where the mortality exists. And so it needs to be not just a discussion about let's invest in country X, but a more nuanced analytic approach which says, which is happening now, which says, where is the mortality? The mortality is focused. The mortality is due to specific causes. The mortality is in certain populations, certain age groups, maybe even seasonality. And let's get smarter about how we do this. Then it becomes, once those issues are understood, at the global level, we can think about advocacy and coordination and financing. And ultimately, the country is accountable for how if they choose to use these resources, how they might use them. And there's a role of the global community in holding states accountable as well.
And so why is that not happening? Why is there this disparities in so many countries? I mean, perhaps the international foreign perception is that in many countries, in the developing world, in Africa, let's say, some of the federal leaders are from one particular ethnicity and they don't want to support the rural folks in an area that is from a different tribe, let's say. Is that one of the reasons, or why are those disparities there?
I think it's a difficult subject to talk about, but I would say that disparities are universal. You don't have to go very far from where we're sitting now to Appalachia, United States, to find groups that are living in close to extreme poverty. And so these issues of haves and have-nots are universal. I wouldn't blame these are just uniquely African issues. These, I think, are global human issues.